The WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Robin, you ready to learn some more?
Oh, I am, sure.
Lauren Devick is here, and Lauren is, of course, the manager of marketing communications at Ocala Health, and she has brought with her another guest, and he's a returning guest. Dr. Angela M Caban is in the studio. Dr. Caban is a board-certified general surgeon, a fellowship trained in bariatric surgery. I'm messing this up. Advanced laparoscopic surgeons, and the founder and CEO of Minimally Invasive Surgeons of Ocala, which means you work with our swallowing and our stomachs and our stuff like that, reflux and all that.
I do a lot of
and that's what we're talking about.
Intestinal surgery. Yep.
Gerd, gastroesophageal. How am I doing, Lauren? Look,
You're doing well. You're doing well.
Reflux disease.
Yep.
GERD.
You got it.
Good morning, Lauren. How are you?
I'm doing well. How are you?
Good. And good morning, Dr. Caban. Oh,
Morning.
Let me put your picture on here. There you go. Now we see you.
Nice to be back.
Yeah. Are you ready for the holidays, or do you celebrate? Do you celebrate?
Yeah, we do.
You do? Lauren, do you celebrate?
Yes, I do.
Everybody doesn't, so you got to be careful, right?
Yeah, you gotta be careful nowadays.
Yeah.
You gotta be politically correct, right?
Yes, for sure.
Yeah, just polite.
I still say Merry Christmas.
Yeah.
There you go.
for sure.
Good job.
You have a Spanish accent, so do you say Feliz Navidad too?
Yeah, that too. I see a lot of Hispanic patients in my office. So,
Do you really?
Yeah.
Well, that would make sense, especially if they are more comfortable speaking Spanish, right?
Yeah. So we have bilingual staff in the office too. So
I want to be bilingual. I can do Pig Latin.
That's excellent. He's very good at that.
that's better than most.
He's very fluent.
Spanish would be the language. I know a little bit. I know how to say "I love you" in French.
I think in Florida, especially in South Florida, knowing Spanish is an asset.
In this
It's a
business,
necessity, yes.
in radio, you have to be bilingual.
Right.
Yeah, they won't hire you if you can't do both.
Oh yeah.
Yeah, because they have these digital. Not to change the subject from the reason, but they have these what do you call it, like sub channels. So like WOCA is just WOCA.
Oh yeah, they're like in Tampa, Orlando, Miami. They have radio stations just in Spanish. They play only
Right.
Spanish
So
music.
like WOCA 2 they would have down there, and that other one would be the same guy doing a Spanish show.
Oh yeah.
Yeah, a different time slot, obviously. Couldn't do it at the same time. That would be crazy. So what is GERD? I know I said the words, but what does it actually mean? Is that acid reflux?
Yeah, so it's GERD is just the medical terminology of having acid reflux. It's gastroesophageal reflux disease as the appropriate term.
And is it something that is caused by lifestyle? I always thought it was a lifestyle thing, like you're eating pizza before you go to bed or something.
So it could be acquired. It definitely can be affected by your diet, but there's also anatomic and physiologic things that can cause you to have reflux.
Oh, really?
Let's say, for example, if you have what's called a hiatal hernia. It's when...
What? A hiatal hernia?
Yeah, a portion of your stomach goes up into your chest.
Oh.
And because of the differences in pressure between your chest and your abdomen, you're more prone to have reflux. So those things you acquire. Most people are not born that way, but usually if you gain a lot of weight or as you get older, you lose muscle mass or your diaphragm weakens, you can have that type of hernias. So you're more prone to have reflux. But obviously the diet does make a big difference.
Okay, now help me with this. Diaphragm usually is referred to your breathing with your lungs.
Yeah, so the diaphragm is the muscle that divides your chest from your abdomen.
Okay.
And it has a natural orifice called the hiatus, where the esophagus goes through and meets the stomach down in the abdomen.
Wow.
If that hole gets too big, then you get what's called hiatal hernia, and then the stomach can work its way up into the chest because of the difference in
Who
pressure.
designed all of that?
God made it so I can pay my mortgage.
Right. I mean, isn't it amazing? I see it's a religious thing. I don't know how people don't think. I mean, you don't have to believe everybody's religion, but there's got to be somebody must have designed that.
Yeah, I'm
I don't
sure there
know.
was.
I mean, that's just amazing. All right, so when something goes wrong, though, that's when you come into play. You fix it.
Yeah, so not every hiatal hernia needs to be fixed, especially if you have no symptoms. Let's say you got in a car accident, you get a CT scan for XYZ.
Oh, wow.
And then they found a hiatal hernia. that doesn't mean you need surgery to get it fixed unless you have symptoms. If it's completely asymptomatic, you probably don't need anything done. But
really?
once you start having reflux, significant reflux or difficulty swallowing, or some people get pain, then you should probably consider surgery.
How long though should they wait? Because a lot of people like to self-diagnose these days and try to treat
Yeah.
themselves.
Yes, so the standard treatment of reflux is usually medical, right? The first thing when you go to your primary care doctor that they tell you is to change your diet, right? So stop eating all the good things like coffee, chocolate, donuts, all that kind of stuff, and don't eat late at night, or just sleep with your bed inclined in certain degrees, just to improve your symptoms. If you're overweight, they're going to ask you to lose weight. If you smoke, they're going to ask you to quit smoking. If all that fails, supposedly you did it, then medications is the next step. But
Can acid reflux be a symptom of COPD?
sometimes people that have really significant reflux could develop pulmonary symptoms, mainly at night when they're laying flat, because the reflux is so bad, goes up into their airway and can cause them to have asthma, or really bad reflux can cause them bronchitis or pulmonary fibrosis. Those are the severe symptoms. For example, when I was at Chance, we used to do a lot of anti-reflux surgery in people that were waiting for a lung transplant, or that had a lung transplant, because you don't want them to have bad reflux and affect their lungs more than they already did.
Oh, so explain that. I think I know what you mean. In other words, the fluids from our stomach
Yes,
comes up and goes back down the wrong way.
Yep.
Oh, okay.
You got it.
And if that happens, what does it do to our lungs?
Well, a lot of people get one of the most common symptoms is coughing at night. So a lot of people cough throughout the night and they don't sleep very well, and they think it's post-nasal drip. So they go to an ENT doctor, to an ear, nose, and throat doctor,
Right.
and they examine them, and they're like, "Oh, you don't have a post-nasal drip. What you have is reflux." And that's what's causing them their cough. Some people will get asthma attacks at night. So those are kind of like the mildish. But if you have those symptoms for a long period of time, then you will develop a more serious complication long term.
Wow.
Doctor, you get to wear those headphones. We have a phone call.
Excellent.
Let me know if you can hear me.
Yep.
Can you? Lauren, can you hear me?
Yes.
Good morning. Thank you for calling. You're on the air.
Yes, thank you, everybody, and thank you, doctor. Say, can gallbladder problems be reversed with a correction in your diet?
So that's another subject, but the main function of the gallbladder is to help you digest the fat. So if you're having issues with your gallbladder, usually the recommendation is that you eat a low-fat diet, or that you have surgery so you don't have to worry about that. So those are kind of like the two options. Symptoms from reflux or gastritis sometimes can mimic symptoms from gallbladder disease. They present kind of with epigastric abdominal pain. Sometimes it goes to your back or your shoulder. Usually happens after you eat. So you gotta try to make a distinguish between the two. But yes, they can mimic each other. And usually, if you're having gallbladder symptoms, usually the recommendation is that you eat a low-fat diet.
If you have a bad gallbladder, would that affect hiatal hernia?
I shouldn't. They're two different issues, but again, the symptoms could be similar sometimes.
Okay, thank you.
No problem.
So if it goes unchecked, Gerd, if the acid reflux goes unfixed, what could happen?
So some of the long-term complications of reflux are one of the first things that happen. The acid is not supposed to be in the esophagus. It's not designed to be that way. So once you have chronic acid there, it starts to cause inflammation, which is usually the first step. It's called esophagitis.
Okay.
So then it starts to get, the longer term you have esophagitis, then you can start developing ulcers or esophageal ulcers. You can have what's called Barrett's esophagus. You can have esophageal strictures.
Oh, wow.
So it can get complicated. Barrett's esophagus is a topic for another day, but pretty much it's a precursor of esophageal cancer. So if you have really bad chronic reflux for a long period of time and you develop Barrett's esophagus and you don't do anything about it, the last stage is esophageal cancer. So yes.
Wow. And to get to that point, you must really be reluctant to go to a doctor. I mean, you must be coughing up blood if you've got an ulcer, right?
Sometimes they can be that way. Yep.
All right, we'll take a little break. And your phone calls are welcome. We love hearing from you. The phone number is 622-9622. We will take a little break. Let me make sure I got everything. Where am I? Okay. Here's where we're supposed to be. All right, we'll be right back. Lauren Debick is here and Dr. Angela Caban. And if you have a question, give us a call, 622-9622. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Some fog patches early Thursday, otherwise variable cloudiness with a shower or two and a high anywhere from the mid-70s in the northern part of the zone to the mid-80s in the southernmost part. Thursday night will turn out partly cloudy, anywhere from the mid-40s in the coldest interior spots to the low 60s along the coast. Friday will be partly sunny and not as warm with a high of 69 to 73. Saturday partly sunny, high 73 to 77. From the Florida Weather Center, I'm Joe Lundberg.
There are only a few things in life that you can be certain will always be around: death, taxes, the pursuit of happiness, and computers. As they continue to advance at an epic pace, the one absolute certainty about them is that they'll break. It's not an if, it's a when. And when it happens, bring it to the only company in Ocala that's certified in Apple and Microsoft, Ocala Mac and PC Repair. They even offer on-site computer repair service, so they come to you. And if you do drop it off, you can check your repair status online. Ocala Mac and PC Repair is a family-owned and operated company that can do everything from mobile repair to wireless networks, fixing viruses, data recovery, even building and installing new systems. Visit online at ocalamacpc.com. In person, 1713 East Silver Springs Boulevard, or give them a call, 352-566-8324. That's 352-566-8324. Ocala Mac and PC Repair.
Here's what you may have missed on the John Tesh Radio Show.
Dogs are experts at reading our body language and the emotional cues in our voice, and they like to do things that encourage a positive response from us. If you would like to ace your next job interview, do not try to be absolutely perfect. Sharing something slightly negative actually makes your good points look even better. Gosh, I just don't think about it enough. If you're worried about germs, then you need to be cleaning off your debit and credit cards.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
All right, 17 minutes after 11 o'clock. You should have heard what we just heard off the air. It was awesome. And we're gonna ask Dr. Caban to explain on the air. But I have this to say to Lauren and Robin. Would you like that bling? That was some pretty cool bling the doctor just showed. That was pretty cool.
I guess we'll show it in the camera.
All right, and so
we're going to show it to the camera.
I'm being silly. Yeah, put it. Robert, can you hold it up to the camera? Or
okay.
Yeah, that way. Yeah. What? Look at this thing. If you're watching, if you're watching the streaming video, just go down a little bit there, like that. It looks almost like a bracelet, but those are little magnets, right?
Yep.
Now explain. That was about an inch, maybe across, I guess.
So they come in different sizes depending on your anatomy. But
what size do you think I need?
Oh, I don't know.
Extra large? All right, I'm sorry, go ahead. So, and you said you're the only doctor in the area that does this.
Yeah, so I'm the only surgeon certified to do this procedure in this area, yes.
Now explain what that is.
It's called the Linx procedure, and it's pretty much a several magnetic beads that increases the pressure of the lower esophageal sphincter. It's the natural valve that we have between the esophagus and the stomach, which controls the acid from coming into the esophagus. If that sphincter gets weak for whatever reason, you are going to have reflux. Medications don't cure that. They just improve your symptoms. So you still have reflux, you just don't feel it because it's less acidic, but you're still having the problem. Surgery is intended to fix the problem,
right,
so you don't have to take the medications. So one of the newer procedures for that is called the Linx procedure. It was approved by the FDA in 2012.
And wow. It stays in there forever?
Yes, so it's supposed to be there forever, and the purpose of it is to increase the pressure of that sphincter so you don't have reflux.
Okay, and you said it's an outpatient procedure?
Yes, so it's done laparoscopically by a well-experienced surgeon in this area.
You're the only one.
And it takes about, if you have no hiatal hernia, if it's just to place this, it takes about 30 minutes, 45 minutes.
Wow.
One of the cases I did here in Ocala, she had a large hiatal hernia, so the surgery took about 2 hours. But it was also an ambulatory surgery. Both of the two first patients we did here in Ocala at West Marion.
Right.
were about 2 months ago. They were ambulatory surgeries, both of them. They went home the same day. One was a young guy, he was in his 30s. The other one is a lady in her 60s. They went into a regular diet right away after surgery.
Wow.
And both of them were off the medications completely right away.
Wow.
Wow.
Do they set off the alarm at the airport?
Good
So that's a good question because everybody asks about this. They don't. Now,
I bet they do, yeah.
If you do the X-ray thing, they'll see it, but it's small enough that it shouldn't. It's made out of titanium, so it's a pretty well tolerated metal in our body. It's MRI compatible to some MRIs. The MRIs come in, there's different classes. The strongest MRI is not compatible with this, but the other ones are. It's not that if you get an MRI, it's going to rip it out of your body and kill you, but it's just going to deactivate the magnets, so it might not work.
Really?
So you might get reflux afterwards, or you might have issues swallowing, so you might need to get it replaced.
Deactivates the magnet. Wow.
Because an MRI is a big magnetic field, right? So it just kind of interferes with the mechanism of this.
I had no idea you could even deactivate a magnet. I never knew that.
Yeah.
Wow. So Robin mentioned off the air the great guests that you bring in, Lauren. You really do. I mean, it's really always an education. If I was going through the airport and they saw that thing and they said, "What is that?"
We give the patients a card.
Oh, you have a card
that you should have with you all the time.
I was going to say I would be so embarrassed to say I have a weak sphincter. It was just, I was like, I don't remember everything. And they'll say, "Isn't that a little high?"
Yeah, right.
Sorry, that's my job. My job, Lauren, is to find something silly in a serious topic. All right, so do we cover it? Does this cover it, like all the complications you might get from Gerd? Will that solve it?
Yes.
Really?
Because it decreases the reflux, so it's taking care of the problem.
So that problem is done then?
So you should, when you look at the studies from this procedure, approximately 90% of the patients are completely off medications. And if you've been listening to the news lately, they have found that some of these medications have serious side effects, which we can debate that all day long.
Yeah.
But they do have side effects, and they're expensive. Many people take them twice a day. So if you can get rid of all of them, and let's say you're 30 years old, and you are taking this medication twice a day already, and you already still have symptoms every once in a while, do you really want to take that medication for the next 60 years twice a day?
I know.
So
I know.
for those patient surgeries, it's a no-brainer. You should totally do this.
Okay.
Do children get this?
So usually we keep it for older adults.
Okay.
Children's will get what's called a Nissen Fundoplication. It's what is considered the gold standard of reflux surgery. It's pretty much we take the floppy part of the stomach and we wrap it around the esophagus in an intent to do the same thing, but it's just using your own anatomy instead of using a foreign body.
And then
there's fundamental differences between the two. The other surgeries are a more invasive surgery because you got to do more dissection to do that surgery. Usually the patients stay in the hospital either 1 night or 2 nights in average. They'll have a special diet afterwards. Usually I put those patients on a liquid diet for 2 weeks, on a soft diet for 2 weeks, and then normal food, compared to the Linx that they go home in a regular diet right away. So there's differences between the two. The outcomes are very similar though.
But if lifestyle or poor eating habits are causing the reflux, and you can tell us that, I mean, would that be an option instead of getting any procedure at all? Just fix your lifestyle. I mean, is it never that simple?
So I'm a big advocate of not having surgery if you don't have to. Right. So if you can fix your problems without surgery by eating correctly, losing the weight, stop smoking, that's great. Now there's people that will do all that and they'll still have heartburn because that sphincter doesn't work at all.
Oh.
So many people will still need surgery even if you do the right things.
So you do the what was I going to say, the bariatric thing to help people lose weight, right? So do you sometimes do that procedure before you do this procedure just to see if that'll fix the problem?
That's a great question, because if, let's say you have really bad reflux and you're considering reflux surgery.
Right.
If you are significantly overweight, one of the discussions that we're going to have, either you need to lose weight on your own or you should consider weight loss surgery, because the likelihood that the reflux surgery is going to work is significantly decreased. So you need to lose weight somewhere or another. So for those people, usually weight loss surgery is a better option, because once you, let's say you went to do the surgery, they have a small hiatal hernia, you fix it at that time, you do the weight loss surgery, they lose weight, a lot of those patients, their reflux will go away. A subgroup of those, let's say you did a sleeve gastrectomy, those might still need reflux. Now, they still might need reflux surgery, and for those, the options are either converted to a gastric bypass or to do a Linx. And when we were at the University of Florida, we wrote a paper about several patients that had a sleeve that had the Linx, and the reflux went away. So it gets a little complex when you're overweight, but yes, you should lose weight either with surgery or without.
How about if a woman is pregnant and then she has these symptoms about reflux? Will you wait till the baby's born?
Yes, because a lot of those will get better once they're... Because the main reason why they get reflux is because of increased intra-abdominal pressure.
The baby's in there.
It's the same principle as being significantly overweight. You increase the intra-abdominal pressure, you promote more acid reflux. Once the baby goes away, a lot of their symptoms go away.
Is there a connection or a way to connect sleep apnea with reflux?
You could, if you have significant reflux that is affecting your breathing. Yes, you could.
The reflux can cause the sleep apnea, or the other way around?
It depends, because sleep apnea can be, there's two types. It's either the central, which is caused by your nervous system, or it could be usually because of your weight. It could be obstructive sleep apnea. And usually those patients, their main reason why they have sleep apnea is because they are overweight, and if they lose weight, it will go away. But let's say that you had, you're a little overweight, and on top of that you have really bad reflux, all that might cause you to have respiratory issues at night. You might be coughing all night long, or on top of that you might have a little bit of sleep apnea, then you're really not sleeping very well.
Wow. Let's see, if you're listening and you or somebody you know has what we call acid reflux, in your world it's called Gerd, Gerd, which stands for, I'm going to give it a shot again, gastroesophageal.
Yep.
You have a soft G there? Reflux disease. Share this video with somebody because I think it's going to make a difference for them. And then the next step would be to call, right, Lauren?
That's correct.
So do we call you?
Can call our health hotline, and the number for that is 1-800-530-1188.
And is it a person or a computer? What do we?
We do have registered nurses on staff 24/7 to answer your questions, and then they can take that next step and schedule the appointment if need be.
And do they normally go straight to Dr. Caban, or do they go to their general physician and then to Dr. Caban?
So it depends on their insurance. Sometimes their insurance requires a referral.
Okay.
Now, what I'll always say is a lot of times the patients are seen by a gastroenterologist or the primary care doctor, and they don't want them to refer them to surgery. They push them to keep taking the medication. You don't lose anything by coming to see me. I'm not gonna tell you, you need surgery. If you take a pill once a day and you never get reflux and it doesn't bother you to take a pill once a day, sure, just keep doing it. That's fine.
Right.
But for those patients that they take the medication twice a day, they still get heartburn. They don't want to. I had a lady that she didn't want to go out to dinner with her friends because she couldn't eat at 8 o'clock at night. Otherwise, she's going to have reflux. So she had to eat dinner at 3 o'clock in the afternoon. What quality of life is that? Listen, we did her surgery, and now she can go eat at midnight if she wants to. It's gone.
Somebody's relating to that.
So it's like, why not? Like, those patients will significantly benefit from surgery, and they still don't do it, either because they don't know or their primary care doctors don't want to send them to surgery.
Gosh.
Yeah, I feel like when you say something like that, there's somebody listening who says, "God, that's me. That's what I'm doing. I'm eating at 3 o'clock only because so they can actually get this fixed."
Oh, yeah. I had another lady, she was probably in her 60s, a similar case where she had significant allergies to most of these medications, and she has been doing research online about the surgery and stuff, but she was not sure. She came to see me in the office probably 10 times before she finally agreed to do the surgery.
It's scary.
When she came back probably 3 months later, she's like, I don't know why I never did this earlier. Like, this is my life. The last 10 years of my life has been miserable, and now all of a sudden it's much better because it's gone.
I'm so glad you told that story. My whole wish when we do any of these interviews is that somebody is helped. And I think the more they know about what you do, the more likely it is that they'll understand that you can help them. So, Lauren Debick, as always, thank you so much. Will we see you before Christmas?
Yes.
Oh, good.
Yes.
Good. Okay. And Dr. Angel Caban, thank you.
You're welcome.
Feliz Navidad.
You too.
We'll take a little break and be right back. Call us if you need any of that repeated or directions on how to get the podcast.
Fox News Radio, I'm Karen McHugh. A standoff between police and a gunman inside a home in Tacoma, Washington is over. One cop is dead, so's the suspect.
One of our guys had for lack of a better term,